of American families. We've now processed $300 billion in loans to more than 1 million small businesses through the Paycheck Protection Program. This action has saved millions of American jobs. It's been an incredible success, and they want to replenish it now. But again, the Democrats don't want to do that. This is money that goes to the workers of our country. Phase one was $350 billion, and now phase two, we want to do $250 billion. This goes to workers, and it goes to small businesses, so we can save all the small businesses around our nation. Mike McFarland from Nebraska recently said this historic relief has been a godsend for his small factory and the 136 Americans who work there. Save those jobs. Another small business owner, Tim Miller from Oklahoma, called the program a total lifesaver for his auto repair shops for employees. Stories like these underscore why Congress must replenish the Paycheck Protection Program immediately. The Republicans want to do it. They want to do it immediately. They want to do it now. And the Democrats are stopping it. A short time ago, CDC issued public health guidelines for critical industries. In a few moments, Agricultural Secretary Sonny Perdue will elaborate on how these guidelines apply to our nation's dedicated workers in the food processing profession, because it's a profession. It's incredible what they do. Food processing, and they're keeping our grocery stores full. The shelves are not bare like the shelves that I inherited when we took over the stockpile. The medical stockpile, where the shelves were bare. The cupboard was bare, I say. Tomorrow I'll also be leading a call with elected officials who will consult with my administration as we work to restore our economy to full speed. And we really think with all of the stimulus and all of the pent-up demand, we're going to have an economy that really comes back quickly, and would like to see it more than match what we had before. What we had before was a miracle, and we think this is going to be even more than a miracle. We're going to do it because we have the greatest people in the world. We'll also be speaking to America's governors tomorrow, and then we'll be announcing exactly what's happening. You already know we'll be opening up states, some states much sooner than others. And we think some of the states can actually open up before the deadline of May 1st. And I think that that will be a very exciting time indeed. Governors are looking forward. They're chomping at the bit to get going. Again, not all states are the same. They're very different. Some are having very little problem. Some have done such a good job that they have very little problem, and they're ready to go. So Vice President Pence and I will be speaking with the governors tomorrow. We'll be discussing procedures. Today I spoke with the leaders of many of our nation's most renowned companies and organizations on how to achieve the full resurgence of the American economy. My discussions included top leaders in health and health care, transportation, technology, financial services, food, beverages, hospitality, real estate, retail, agriculture, construction, energy, labor, manufacturing, and sports industries. We want to get our country open again. We want to have our sports leagues open. You want to watch sports. It's important. We miss sports. We miss everything. We want to get back. These experts and innovators provided extremely productive feedback on how to safely reboot our economy. They gave us a lot of great ideas. We spoke to a lot of very, very smart people. The highest of the high tech. The level of IQ on some of those calls was about the highest you've ever seen on a phone call, that I can tell you. But we have a lot of great thought went into those calls, and a lot of questions came out, and also statements, very strong statements as to what they recommend. I think it was a great day. We did a lot of calling with a lot of very prominent people, but more importantly, very smart people and people that love our country. They talked about the vital importance of our wide array of relief measures to address the present crisis, and they provided valuable insights on how to move forward, including on the role of protective gear, where we have tremendous amounts of protective gear coming in, robust testing, and the future use of therapies and treatments. They also underscored the crucial importance of strong supply chains and communications infrastructure. We're talking about infrastructure for the middle of our country. We're talking about broadband and things that they frankly don't have and haven't had for a long time because a lot of politicians forgot about them. Can't forget about them. They're really the heart and soul. Can't forget about them. And we're talking about the telemedical. It's a new thing, and it's incredible what they've been able to do. This is an industry that's just growing, but it's grown by leaps and bounds over the last 5 weeks. People are learning so much. Without the ability to see a doctor, they're learning so much, and a lot of good things are happening. That's something that's really, going forward, I think, going to be very important for our country. As we've seen throughout our proud history, America is never greater than when our people are working in unison toward a common goal. That's what's happening right now. We'll go ahead, we'll forge an even brighter future today than we had, and we'll be, along with other nations, hopefully, we're working with other nations, we'll be the comeback kids, all of us, all of us. It's incredible what's going on. I'm very proud of the people of this country. I'm very proud of the people I spoke to today. These are truly great, brilliant people, and we've gained tremendous insight. So tomorrow's going to be a very big day. We're going to be speaking with the governors. We'll have some information on some openings. And again, we'll have some openings that will exceed our expectations, and they'll be safe, they'll be strong, but we want to get our country back. We want to get our country back, and we're going to do it, and we're going to do it soon. With that, I'd like to ask Dr. Birx to come up and say a few words, and then Secretary Sonny Perdue, and then Vice President Pence. Thank you very much. Thank you. Thank you.
Thank you, Mr. President, and thank you for summarizing the states and what we're seeing. So over the last 5 to 6 days, we've seen declines in cases across the country, and this has been very reassuring for us. At the same time, we know that mortality and the fatalities that we're facing across the United States continue. We know the number of people who are still in the hospitals, in the ICUs, and we want to continue to recognize the healthcare workers who are on the front lines and really recognize how low the United States case fatality rates are compared to other countries. And this is really due not only to our technology, but how that technology is utilized to save lives. At the same time, I'm inspired by the American people who continue social distancing. These cases continue to decline because of the strong work of the American people. Also wanted to let you know that we do have 9 states that have less than 1,000 cases and less than 30 new cases per day. So we're looking at states and metro areas as individual areas. We talked before how each of these curves are different. Each of the cases' experiences are different. We have some states like California and Washington State, Oregon, that never really had a peak because of so much work that their populations did to decrease and keep the new cases down. So each of these individual states and individual metros are being studied very specifically. I do want to highlight, and we are remaining concerned, and we've been having discussions with Rhode Island. Rhode Island and Providence are in a unique situation. First, they had increasing cases from the New York City area, and now they have new increasing cases from the Boston area. They're caught between 2 incredible hotspots in the country. They're doing an extraordinary job. They're caring for the individuals in the front lines, but Providence continues to have new cases. And we do continue to work with specific states that have specific outbreaks related to individual occurrences. I will just remind the American people again, this is a highly contagious virus. Social gatherings, coming together, is there always a chance that an asymptomatic person can spread the virus unknowingly. No one is intending to spread the virus. We know if you are sick, you will stay home. But to all of you that are out there that would like to join together and just have that dinner party for 20, don't do it yet. continue to follow the presidential guidelines. We really appreciate the work of the American people. We see as a country we're improving. We see as metro areas we're improving. We see as communities, as counties, and as states we're improving. But that also still requires everyone to continue to social distance. And in the end, we do have states that have very few cases and very few new cases. And so these are the ones the President is referring to that have been silent, relatively silent throughout this epidemic and pandemic that many of us have faced. And so these are the groups we're working with very specifically. And each of these governors and each of these mayors will have to make decisions after generalized guidelines are put out so that they can do what's best for their communities. They are at the front line. And I wanted to conclude by really thanking my PEPFAR teams around the world who have been working tirelessly throughout the world to ensure that Africa and Asia doesn't experience this level of infections that we have seen here. They've turned over their capacities from their embassies. Our U.S. hires throughout the world, our ambassadors, are still on the front line with our local staff, working with ministries of health to confront this virus around the globe. And I assure you that they are continuing to invest in the health structures, the laboratory, and the frontline care to ensure that all of the work that we have done against TB, HIV, and malaria continues, but that we use our capacity, our laboratories, our clinics, our hospitals that have been built by the American people and the generosity of the American people to really combat this COVID-19 around the globe. Thank you.
Thank you very much. Thank you, Doctor. Sonny, please.